Hello, everybody. Welcome to Chapter 35, Lecture Part B. It's the continuation of the anxiety disorder. So, in this chapter, we begin our discussion with supporting the client with anxiety disorder. So, what is our role here as a personal support worker? Our role is to support the client who are diagnosed with those disorder, anxiety disorder. So this is called the intervention part of a support worker. How we can help them, that's called intervention. So our role here can be how to minimize the level of anxiety from our part by providing them necessary comfort. For example, if the person who is having the anxiety disorder, so the person needs certain help with going to washroom or changing dress or some grooming type of activities, mouth care, some support while going for the shopping mall. And in that situation we have to support the person as per need. And do not forget that your nursing care plan is the main book. That's the main thing to follow. What kind of support and what situation and what kind of support we are entitled to, we are supposed to provide them at right time. So let's begin how we can help the client having the anxiety disorder. The first point here says is avoid situation known to cause anxiety. Let's not talk about certain the sad things like the death of their loved one, or how they went to those financial crises in the life situation, how the separation took place in their life. Like those topics are totally opposite to discuss at this point. That's why we have to ask the client, or we have to discuss those topics that makes them happy or that minimize the level of their anxiety. Similarly, avoid discussing the subject that cause anxiety. Exactly the same thing. Do not talk about those subjects that potentially cause more anxiety to the clients. Similarly, we have to provide them the comfort during the period of anxiety. What kind of comfort? It depends on. Sometimes we may have to help them to go to the washroom. They are in the advanced age, maybe 80 or 90s of their age, and they have those anxiety, and they may have other further combined with other different health condition. That's why to minimize their anxiety, our role is to provide them support, either helping them in going washroom or changing the linens or putting their socks on or giving them oral care or playing some music or opening the TV. Whatever makes them comfort, we have to think in that way. Similarly, our next discussion will be on the post-traumatic stress disorder. Let's understand what this post-traumatic stress disorder. Post means after, traumatic means certain bad event that has taken place. Stress means that event caused the stress and that leads to the disorder. Post-traumatic disorder. PTSD usually occurs after the terrifying ordeal, terrifying event. The event involved the physical harm or the threat of physical harm. The two things might have happened there, either the physical harm or the threat of physical harm. Somebody is just going to shoot somebody or stab somebody. That's kind of immediate threat that causes the post-traumatic stress disorder. PTSD can develop after being harmed by somebody, after a loved one was harmed by somebody, when our loved one, our friend is being harmed, or our client's friend is being harmed. That's why the client has the post-traumatic stress disorder. Or after seeing a harmful event happen to loved ones or the stranger, it doesn't matter. They must not be the loved ones. Maybe they are the stranger. For example, you were walking in the street, somebody came and stabbed somebody, and you saw the event, and that event causes stress in the mind, and that is full of the trauma for the person, for the victim. The victim experiences different trauma there at physical or psychological level, and after the trauma experienced by the client, you have the stress in the mind which you cannot minimize in that way. So that at that situation, people have this disorder, post-traumatic stress disorder. Most people with the PTSD have flashback. Flashback is the the past event coming to the memory at present, and the past event is occupying the whole mental activities as present. For example, we saw certain um, traumatic event 10 years ago. Now um, we just happen to get those flashback of the event in the mind today now, and our mind is totally occupied by those events, situation, those realities, those tragic feelings. That's how it works. A flashback is reliving the trauma in thoughts during the day and in nightmare during the sleep. See, the nightmare is a very, very bad experience during the dream. That's the nightmare. It's like dream-like situation. People is starting crying, people trying to stop, people are yelling at somebody. These are called the nightmares. Very, very bad experience. When they sleep, they feel, and during the day, they also feel the same thing. So, like the whole mind, the functioning of the mind is totally captured by those traumatic stress disorder. That's how people go with this. PTSD can develop at any age. It is not the age bound. It can develop at any age. Now we are focusing our discussion on the obsessive compulsive disorder. These are obsessive. The mind has one idea that goes with obsessive, and compulsive is according to that idea, person performs certain act. Mind has some idea, and that idea leads to do some acts here, performance, and related disorder. Let's discuss. It is characterized by the recurrent obsession. Obsession means if certain event, situation, memory, flashbacks, idea, thought comes to the mind for whole day, it goes like obsession. And compulsion that interfere with the person's daily life and relationship. So, in obsessive compulsive disorder, first the recurrent obsession, certain memories, certain event, thought process comes to the mind, and that thought process interfere. It disturbs, actually, it disturbs with the person's daily life. Person's daily life is totally impaired when the person has this disorder impaired, and the person's relationship like a conjugal relation, wife husband relation, the family relation, friendship type of relationship, social relation, professional relation, every type of relationship is disturbed, impaired, dysfunctional because of this disorder. Obsession, it is clarifying very beautifully here. Obsession is a persistent, means continuous thought or desire. That's called obsession. Once again, let's repeat. Obsession is a persistent thought or desire, a continuous thought or desire in the mind, and compulsion is the uncontrollable. The person cannot control it. It's uncontrollable. Urge, another desire, urge to perform an act. I give you one beautiful example. Like hand washing, it's given here. Somebody told that hand washing makes you prevent from those bacteria and viruses. You have to do the hand washing. You read in the book and somebody told you, and many people keep on telling you the same thing repeatedly, and your mind is obsessed with hand washing, hand washing, hand sanitizing, hand sanitizing. See the situation. If you observe repeated behavior, all people repeatedly telling you hand washing is very important, hand washing is very important, or your client, and report them to your supervisor. If you observe repeated behaviors, report them to your supervisor. And you are repeating hand washing all the time. Or your client has the idea that hand washing keeps them free of bacteria and virus, but the client is showing the repeated behavior. Now our duty is to report them to your supervisor, to the nurse in charge. Why the client is repeatedly showing that behavior all the time? Example, repeatedly washing hands, checking the same thing several times a day, checking the same thing several times a day. You put your cell phone in the bag. All the time you are checking your bag if your cell phone is there or not. Because somebody told you that cell phone are being stolen nowadays very much. You are obsessed with the idea and your compulsion is checking them in the bag. So this is another type of disorder. Other obsessive compulsive disorder could be hoarding disorder. Hoarding means what? Hiding something. Hiding. You gave a glass of water to drink to the client. Client says, okay, I will drink it later. But later what the client does is he or she puts the glass of water under the bed. It's a hoarding. Can be hoarding of the medication, hoarding of the food, hoarding of everything. That's the hoarding disorder. Now is body dysmorphic disorder. What do you mean by body dysmorphic disorder? So, the body dysmorphic disorder is the changing of the facial appearance and certain artificial stops putting outside the face or other body parts. That's a mental health disorder. It's usually the young people have this disorder of changing the body, how the body looks more beautifully. It's a that type of disorder. Trichotillomania disorder, hair pulling. See once again, this is a difficult word. Trichotillomania. Trichotillomania disorder, or it is a hair pulling disorder. Some people pull their hair because their stress level is so high that they cannot minimize their stress or they cannot manage their stress level. That's why it is the excessive performance of expressing their frustration, anger by pulling their own hair. That's that type of mental health disorder. It is also the obsessive compulsive disorders part of that. And excoriation disorder, that's skin picking. Excoriation disorder is skin picking disorder. It's another type of disorder. Substance medication induced disorder. What do you mean by substance? Substance could be anything that is considered as a medication, but it is abuse that substance. Anything like marijuana that might cause certain disorder, like brown sugar, like cocaine, or usually prescribed medication. They may cause, like mental health medication are very strong, very potent. These medication might cause medication related. Medication induce means related. disorder. Those medication may be causing them hallucination, the delusion and intoxication. These are they caused by the substance or medication related disorder. Similarly, we are continuing the same point of obsessive compulsive disorder, certain idea in the mind that is obsessive, and to fulfill the idea, the person is doing repeatedly doing certain performance according to this idea. That's called compulsive performance. That is a performance level disorder. So our role as a support worker could be so that you enjoy being with the client, be positive. Just establish the therapeutic relationship with the client. Be very positive with the client. Let the client feel that you always feel happy to be with them and they are with somebody else. They feel, they are secure in your presence. Do not minimize the client's problem. The client may have so many problems. If you minimize, you are being judgmental. Do not minimize their problem. Their problem is their problem, and don't tell them you are okay. Don't worry about that. These are very problematic sentences in nursing. They have a problem. They know it. Everybody knows it. Family knows it. And who are we, support worker, telling the client, don't worry about that? That's a big mistake. Encourage the rest because at a physiological level for the body, for the client, the rest and activities are very important. Encourage the rest, allow the client to feel cool, and ask the client how they feel rest. Let them sleep on the bed, sit on the sofa or chair wherever they like, what is possible. Give the possible facility for encouraging the rest. Avoid helping behavior around obsessive compulsive disorder. Avoid helping behavior. Oh, the person wants you to do something. For example, the person wants to do the hand washing and the person doesn't have any soap in the water tap, and the person is calling you to bring the soap, yelling at you to bring the soap at anyhow, and you can say there is no soap. I have to order the soap. Just avoid the helping them in the helping behavior around the obsessive compulsive disorder person. So try to use a little bit trick. And this trick is not for your benefit, it's for your client's benefit. That's the trick is just to avoid that. Provide a safe, what type of environment we have to provide them? Safe, secure, and stable. 3 yes. Safe, S, secure, another yes, and stable, another S. Safe, secure, and stable environment. And follow the care plan. Once again, this is the biggest thing. This is our big book. You can say this is the main, the roadmap we have to follow. Encourage normal activities. Let the person encourage other activities rather than the repeated activities. Encourage the person. Recognize accomplishment. If they say they have accomplished certain things in their life, just recognize them. Express the empathy and encourage them and recognize their accomplishment. Now we are shifting our discussion to eating disorder. Remember, when people have eating disorder, either they eat a lot more than they need or they do not eat what they need. Arise from altered body image. When a when a person sees the body in the mirror, the person has altered, a twisted view of the body. Image perception leads to disturbances in eating behavior. Those altered body image will be reflected in their eating behavior. It leads to disturbances. Their eating habit will be dysfunctional, it will be altered. Their eating behavior changes all of the sudden. and abnormal concern about the body weight and shape. They are more worried about what will be their body weight. Their body weight. They don't want to be very fat or very heavy. And because the shape of the body will be disturbed by that, it's called all about the eating disorder. Occur mainly in the teenage girls. Remember this word. This eating disorder is mainly goes with the teenage girls and the young women. They want to keep themselves very beautiful, fit, and attractive in front of other people. Example, anorexia nervosa. There are two types of eating disorder. One is anorexia nervosa, another is anorexia bulimia. In the word nervosa, something different happens. In anorexia bulimia, something different happens. Can anybody tell me what happens? What is the difference between anorexia nervosa and bulimia? Remember, these are your exam question. Probably. I'm 80% sure about that. Let's talk about anorexia nervosa. See, the word nervosa being the nervous, being dysfunctional. Anorexia nervosa occurs when a client has an intense fear, nervousness, fear of weight gain. Now you can connect the word nervosa with the fear with weight gain. See, because they are nervous, they have a big fear of weight gain and distorted body image. After gaining the weight, their body image will be totally distorted. That's how they are full of fear. That's the mental health disorder here. The client believes that she is fat despite being dangerously thin. See the word despite, although she is dangerously thin, she is very, very thin. She is not, she is lacking the necessary muscle in the body, but she believes that she is fat. See, the client believes that she is fat. Strange eating habits and refusing to eat in front of other. That's the strange eating habits. Their eating habit becomes very strange, and they refuse to eat in front of other people. They don't want to go to the dining room, dining place. Intense exercise. They keep on doing exercise, and vomiting are common. They vomit a lot. Because if they don't vomit, the food will be digested in the GI system and they will get very, very fat and big muscles in the body. Some people abuse laxatives and enema. Laxatives, they causes the diarrhea, or enemas, they also causes diarrhea. These are the medication given for the people having the chronic constipation. But these these girls and the young women, without having chronic constipation, they are using the laxative because they don't want the food to be digested in the GI tract. Rather, it goes away as soon as possible. That's why laxatives and enemas, they are the stool creator. They cause heavy diarrhea. Diuretics abuse may occur. See, the diuretics, these are the medication, certain blood pressure medication, diuretic medication, these are the abuse. They can abuse those medication. Death is at risk. And remember, this is a mental health. That's why death is high risk from the cardiac arrest and suicide. This is a diuretic is a medication that causes maximum pee. They urinate. And because of that, it alters the cardiac functioning, because when people pee a lot, their blood volume is decreased, and when the blood volume is decreased, the circulatory system is dysfunctional, and the cardiac arrest means the heart attack or suicide might happen. That's why Eating disorder may look very simple disorder, but it is not. Once the client starts abusing the medication, it is life-threatening. Similarly, the second type of my eating disorder is called bulimia nervosa. Bulimia occurs mainly in the teenage girls. See, teenage girls and young women, characterized by the episode of binge eating. It is pronounced as binge eating, a lot of eating, followed by the inappropriate methods of weight control. Example, purging. What do you mean by purging? What is this? It is vomiting, just throwing up. They eat a lot of food at the same time and they realize that they did a big mistake. And now they inappropriately they misuse the eaten food either by putting the finger or whatever other ways they just vomit them. The client eats a large amount of food, then the body is purged, rid of those food eaten to prevent the weight gain. Vomiting using laxatives means the diarrhea causing. Enemas, again the diarrhea causing. Diuretics, these are the blood pressure medication. Fasting, they don't eat properly. And intense exercise, they go to the gym and do the very, very intense exercise, are some of the method used to purge the body, purge the food, body of food. They take the food out of the body. That's called to purge the body of food. So basically, bulimia nervosa is eating a lot and vomiting the food, getting the body, getting the food out of the body, just getting rid of the eaten food. Now we are discussing about pica. What is pica? Looks a little bit new to everybody. What do you mean by pica? Pica is defined as persistently, continuously eating substances without nutritional value for a period of at least 1 month. See, persistently, continuously eating the food or any substances. It doesn't have to be food, any substances, any substance. Even people eat soil without nutritional value. Even sometimes they eat some wooden stuff, the dust of the wood, for the period of at least 1 month. Example include clay, see, clay, mud, dirt, sand, even the sand, not only sand, holy cow, they even eat stones, pebbles, hair, fishes, lead, that's the poison, lead, laundry starts, see, v- vinyl gloves, plastic, pencil, eraser, eyes, fingernails, paper, paint, chips, coal, even the coal they use to make the fire, chalk, wood, I told you, the wood, plaster, light bulbs, needles, oh my god, a string, cigarette butts, wire, and burnt matches. After they make the fire, the matches is burnt. They also eat that pica. It's a devastating mental health disorder. See how the people eat all these non-edible things? The thing which are not supposed to eat is called non-edible. It's not edible, it's non-edible things. Some nutritional deficiency may cause pica. When people have certain deficiencies, nutritional deficiencies, like malnutrition maybe, that's called pica. Now we are discussing about sleeping disorder. Some people have sleeping disorder. They sleep, go to the bed, but can't sleep. Or even if they sleep, they are just walking sometime in the sleep, or their sleep pattern is totally dysfunctional, not functioning well. Sleep is essential for normal healthy function and classified the sleep into 10 conditions. different sleeping disorder are classified under 10 into 10 condition. Insomnia. Insomnia is a lack of sleep, most common disorder. People have different memories coming during the night. That's why people cannot sleep, lack of sleep. That's called breathing related disorder. The breathing related disorder, it is called sleep apnea. It's not maybe given here. I don't think it's given here, but it's called sleep apnea, breathing. When people sleep, the backside of the tongue blocks the airways and people start snoring all the time. These snoring people, not all the snoring is sleep apnea, but most commonly when people snore during the night when they sleep, it's called sleep apnea because of the base of the tongue blocks the airways, gas exchange with the lungs, and they have difficulties. Hypersomnolensis disorder. Hypersomnolensis disorder. What happens here? Hypersomnolence disorder. It is excessive daytime sleepiness. Person wants to sleep all the day. This is the sleepy mood during the day. And narcolepsy. Have you heard the word narcolepsy before this? Narcolepsy is another sleep disorder. During the day, again, the person is having all the sleepy mood, and all the time person goes to sleep. That's another sleeping disorder similar to hypersomnolence disorder. Circadian rhythm sleep wake disorder. Human being, they live like the biological clock. It's called circadian rhythm sleep wake disorder. When it is a night time, people feel sleepy. When it is morning time, they wake up. But in the circadian rhythm sleep wake disorder, people don't follow the clockwise sleeping and waking schedule. When it is a evening, late evening, like 9 or 10 p.m., they go to sleep. But in this disorder, people don't have that cycle. Their sleep-wake cycle is totally disturbed. Nightmare disorder. When they sleep, during the night, they have a very tragic event as their dream. That's the dream situation. They have a very, very bad dreams. That's a nightmare. And NREM disorder and REM disorder. NREM is a non-rapid eye movement disorder. It's a rapid eye movement disorder. When people sleep, they are different cycle of sleep goes on. It's a non-rapid eye movement disorder, and this is a rapid eye movement disorder. People don't go for the deep sleep, and people don't go for the deep sleep. This is going deep sleep and not going deep sleep type of disorder also happens uh, among the sleep disorder. And Willis-Igbone disease. What do you mean by, have you heard about the Willis-Igbone? So this disease, and again, we have another type of disease, substance medication induced sleep disorder. When people have a medication induced sleep disorder, this is basically caused by the medication, because the clients, they are diagnosed with different type of disease, and those disease are being treated for the symptom management and curative purpose. So many medications are being given to the clients, and because of these medication, they alter clients sleep wake pattern, and it is considered sleep disorder. Now we are continuing the same thing, supporting the clients with sleep disorder. Now our job begins from here. How to support the client having those sleep disorder. This is our main job. Client should avoid the foods and medication that alter mechanical balance, like caffeine. When before they go to the sleep or even during the day, clients should avoid the foods that disturb their their sleep pattern, or the medication. Certain medication, they don't allow person to feel rest and sleep. So those medications should be avoided. That alters chemical balance. That means in the body you have so many chemical balance, the hormonal balance. Those balance are disturbed by those caffeine. You know, generally the people who drink coffee during the before they sleep, they cannot go to sleep because it impairs the sleep wake pattern. When people have to work the whole night, they drink a lot of coffee because it makes them awake. Encourage client to seek medical attention. So if your client, you are working in somebody's home as a community support worker, your client is not sleeping during the night, what do you do? This is a very, very important question for you. So encourage the client to seek medical attention. Encourage the client not to drink coffee. Encourage call the nurse or nursing supervisor to change the medication, because those medication, if you know those medication may be altering the sleep pattern, you can talk to your other healthcare professional. Observe. This is the prime duty of a support worker. We have to observe all the way. We have to report when we see certain alteration in the behavior. Record each documentation. We have to record how long the client is sleeping during the each stage of sleep, and make note of the client use of prescription and non-prescription drug or alcohol. Does the client take alcohol, drink alcohol, or what kind of non-prescription means? What do you mean by non-prescription? It is called over-the-counter medication. Over-the-counter medication, what happens? You don't need to go to the doctor for the prescription. You just go to the pharmacy and buy the medication. That's called non-prescription. And prescription medication is what the doctor has prescribed. So, see the whole scenario. If the client is drinking a lot of tea or coffee, that makes caffeine a lot in the body, and because of the caffeine, client cannot sleep. Or if the client has other dysfunctional sleep-wake pattern, encourage the client to seek the medical help. There is always just medical support for the client, and you have to do observe, report, and record how long the client is sleeping, how long the client is not sleeping. Make the note of the client's use of medication, drug, alcohol, how often the client smokes. Sometimes the smoking gives nicotine that also alters the person's sleep wake cycle, and so on. Now, this is a most common behavior with the mental health people. It's a suicidal behavior disorder. Person wants to commit suicide, or person wants to do the self-harm. That's called suicidal. The person has recurring thoughts, the idea of taking one's life, thoughts or preoccupation with ending his own life or her own life. We cannot be the gender bias here. His or her. We have to write here his or her. Preoccupation with ending his or her own life. Attempted suicide is a sign of a serious mental health issues. Remember, once person has made an attempt to make suicide, it's a serious mental health disorder. Once person tried to kill himself or herself, the person will be committing suicide, and the death of the person will be because of the suicide, healthcare book says. And professional care is needed. We need to support the client, we need to report the client condition to the supervisor, to the family, and everybody. Everybody means those who are relative peoples in the care process, not outside that area. Who are everybody? Everybody could be the doctor, could be the nurse, could be the family member, power of attorney, POA, and the client himself, or you, the support worker. Any person talking about suicide should be taken seriously, because when person start talking about the suicide, it is very serious matter. It's a suicidal, considered as a suicidal behavior. So, what are the risk factors related to the suicidal intent or the behavior? It's called suicidal ideation as well. Another terminology, idea. From idea, it's called ideation. Mental health disorder, especially depression. When a person has a depression, the depression may lead to the suicidal. Bipolar disorder may lead to the suicidal. Schizophrenia may lead to the suicide. A history of abuse, when a person as a child is abused, as an adult is abused. There are so many type of abuse: sexual abuse, financially abuse, emotional abuse, like so many type of abuse. Abused person can be showing the suicidal behavior. A family history of suicide, when a person has a family history of suicide, the person is very risk of committing suicide. The suicide of a friend, if a near and dear friend has committed suicide, person is very much influenced by that type of temperament. Idea, a prior suicide attempt, as I told you, when a person has made certain attempts to commit the suicide, the person might die because of the suicide. And a major crisis means loss of the family member or the divorce or financial crisis, which is called bankrupt, everything. These are the major life crises. Pressure to success. When person has a pressure to get success, the person may be taking it in a negative way and committing suicide. These are very, very serious situation of a person diagnosed with mental health disorder. Now, what are the risk factors? What makes a person think like those ideas of taking his or her own life? Intent or behavior? Isolation. See, when a person is alone, one person is in isolation, in alone, nobody is there in the family, person may have that idea. Early losses in life, early loss of life, loss of money, loss of business, loss of profession or the job. It might lead person to commit the suicide or think about the suicide. Sexual identity crisis, there are different sexual identity people are talking about, like lesbian, gay, bisexual, transsexual, and all other people. Because of that also people try to commit suicide because they are not recognized as a gender in the society. It's a new issue. And feeling of deep hopelessness and helplessness, this is a pessimistic thought in life. This is a hopelessness and helplessness. Nobody is there to help me and I have no hope. These are very, very pessimistic or negative feelings. Because of that, people may think of taking his or her own life. Recent diagnosis of life-threatening illness, like the third stage of cancer. People's independent life is compromised. They become dependent on others, and because of the life-threatening illness, people think about taking his or her own life. And substance abuse, this is very, very common. People who use the medication, substance abuse, those people, I mean the drug addict, they are the most common people to commit the suicide as well. Now, additional risk factor for the older adult. So, how the older adult have more other risk factor, personality factor. See, the personalities. There are different personality of the person, and some people is sociable personality who live in the with the friends and the near and dear people, that type of people. And some people are not like that people. Some people are very arrogant, very chauvinistic, and who like dominating other people. That type of people may have those problems. Certain medical illness such as chronic pain, people want to get rid of the pain forever by committing suicide. Sensory impairment, people can't see what's going on in the world. See, And what is they can't hear? Sensory means there are five sense organ in human body. All the sense organs or the majority of the sense organ they cannot function. Person cannot hear, person cannot see, person cannot taste, person cannot feel. See, these are the conditions. That's why people feel that they can take their own life. Negative life event, death of somebody, such as loss of the financial difficulties or death of somebody, or the bankrupt, their financial condition is totally destroyed. They can't make any money in the life. In that situation also, people have that idea of taking one's life. Functional impairment, when person's functional condition is compromised, people cannot walk, such as the loss of the independence or problem performing activities of daily living, ideals. Even people sometimes has the suicidal thinking. That's why always be near to the person and ask the person what kind of thinking. If the person expresses suicidal thinking, tell the person, talk me more about that. Document it, report the nurse or the supervisor. Now, another type of mental health disorder, that's a disruptive. It's a totally violative, disruptive, impulse controlled. It's not mind controlled, not the logically controlled. It's the impulse, desire, certain instinct, that impulses, emotion controlled, and conduct disorder. These are the very common type of disorder. Mental health disorder relates to difficult, disruptive, aggressive. See, very violent, aggressive. Disruptive means very violent, and antisocial behavior. Antisocial means which goes against the social rules and regulations, social values. What are the social values? In the society, we have the feelings of coexistence. We live together no matter what is our background, what is our nationality, or whatever. That type of society, we have to live in a proper coordination. But when people are antisocial, they involve in the theft, in the murder, in the burglary, in other antisocial activities which society does not approve. Client may be using ineffective emotional coping method. What do you mean by ineffective emotional coping method? When people have a high stress level, they go and drink wine. Because of the wine, another level of they become more disruptive. So that's called ineffective emotional coping. Effective emotional coping could be taking help from the family and friends, taking help from the healthcare professional, that is effective. Ineffective, not taking help from the family and friends and healthcare professional, but taking help from the alcohol, from the drugs, from the substance abuse. These are called ineffective emotional coping methods. Three types: angry, irritable mood. When people are angry or irritable mood, it is considered disruptive, impulse control, and conduct disorder. When people have argumentative or defiant behavior, always people are defensive and argumentative. They don't listen, but only want other people listen them. And vindicativeness. What do you mean by vindicativeness? The word vindicativeness means it's a revenge psychology, taking revenge of the event with the person or the situation. Now we are discussing about oppositional defiant disorder, repeatedly engage in the pattern of defiant, disobedient, and hostile environment, hostile behavior towards authority figure, just fighting with the police officers. That begin in the childhood, that begins at home, they're fighting with the parents, and in the school, fighting with the teachers, and in the adult life, fighting with the authority figure like the police officers or the security guards. They are just the thinking in a hostile behavior. Goes beyond the acceptable misbehavior for the child says. Sometimes the child are showing those behavior which goes beyond the acceptable limit. Continues for at least 6 months. If the child behavior goes like that for more than 6 months or at least 6 months, the child is very high risk of developing this mental health issue called oppositional defiant disorder. Intermittent explosive disorder. Intermittent. Intermittent means not all the time, sometime. All the time is persistent. Intermittent explosive disorder. Recurrent behavior outbursts. Recurrent means repeated type of behavior that outburst, indicating a failure to control aggressive impulses. The person fails to control the impulses. Outburst may be physical or verbal. The outburst may be physical or verbal. It can be physically harming others or just verbally abusing others. The anger is caused by the inability to cope with the situation, that cope with the mentally with the situation. The person is unable to cope with the situation. That's the intermittent explosive disorder. Now the conduct disorder. This is a conduct. Every conduct should be acceptable type of conduct. People repeatedly violate the personal or proper property rights of others in the society and the society. The personal or the property rights of others in the society usually begins in the childhood. See, it begins in the childhood with the lying, shoplifting, shoplifting, and then progresses to more severe behavior like burglary, auto theft, stealing somebody's car, and driving those cars or selling them for somebody, drug abuse. Several causes including severe family dysfunction. When the family is not functioning well, when the parents are not giving proper education, when the parents are not living a happy life, their children have those conduct disorder. So it goes to burglary to auto theft. These are the very criminal activities. And childhood, it starts from the childhood by lying for somebody. Always be careful with the child. Supporting the clients with the disruptive impulse control and conduct disorder. So here all the three type of disease mental health issues are there, and we are here how we can support those clients having those mental health condition. You must accept the client in a caring, non-judgmental way. You have to take the client as a person. Do not make any image of the client. If you make the image, you will be judgmental. So we have to be non-judgmental. Take the person as it is. Avoid doing anything that may escalate, means increase the situation. Try to avoid anything. Do not, so what could be this example? Avoid doing anything that may escalate the situation, means that may cause the situation getting worse. So do not speak in a jerky way. Speak in a very calm and quiet manner that makes the person also copy you, follow you. Try to determine the cause of verbal aggression. Why the person is using verbally aggressive behavior, using very bad words to other people. So try to determine what is the cause of that verbal aggression, the anger by using the words. That's called verbal aggression. Use services available within your place or the employment facilities. If there is any support services, use them. If there are anything support services, so what are the support services? If they are very violent and threatening you, the support worker, then call the security guard, or um, they can do their intervention, their work. Ensure your own safety. Always your safety is number one reason, and other safety is you can save other people once you are safe. Therefore, your safety is always must be ensured, and that of others. If the client threatens you verbally or physically, maintain a safe distance between the two of you, between the client. Don't go very near the client. Maintain 3 meter distance, 2 meter distance, and ensure that you have an open pathway to exit. So don't go to the area where there is no exit, alternative way to go out. Always make sure if the client approaches you all of the sudden, you must have to get the good exit from there. You have to go out of the room, out of the house. So make sure you have an exit there. So this is you are ensuring your own safety as well as client safety. And substance related addictive disorder. So substance, drug, abuse of the drug, and those related addictive. When person abuses the drugs, person becomes addictive of those drugs, and it is a mental health disorder. So if the deliberate misuse of any inability to stop the abuse of prescription medication, when a person uses the prescription medication, misuses it, it's not using, it's misusing. And those prescription medication like pain medication, narcotics, and all other medication they are taking for their personal satisfaction. Like illegal drugs, they are buying illegal drugs. They are also using alcohol, which is equally dangerous, and other substance like the street drugs, the drug cartels. They are selling those drugs like cocaine, heroin, and all other drugs. Even the marijuana is under the drug now. It's been legalized in Canada for certain level. Substance abuse or addiction occurs when a person overuses, excessive use of that, overuses depends on alcohol. When the person is alcoholic, remember everything goes astray, goes horrible. Like using alcohol, overuse of the drug, illegal drug which are not legalized by the government, or prescription medication. For example, some prescription medication are ordered only for the client who has certain condition. But here, the abuser used the prescription medication without having those other disorder. That's how they are abusing the medication. The client physical and mental health are affected by the abuse of the drug. The mental and physical health are affected, as is the welfare of the others. Many are mood altering of substances. Their mood. Certain drugs, they don't smell bad, but they are very, very mood altering. All of the sudden, person becomes so much violative. They want to kill other people in the street. They want to fight with other people in the street, in the bus, in the subway, in the street, everywhere. Therefore, the substance addictive people are very dangerous, and sometimes they have the past history of the criminal charges and so on. Alcohol use disorder, AUD. See, alcohol is not very simple thing. People have alcoholic and they have chronic alcoholism is a very, very serious health condition. Alcohol is abused more than any other substance. This is the most common mental health disorder, alcohol abuse. Sign and symptom of alcohol abuse include intoxication. It is mean that when person takes alcohol, person's consciousness is altered. It's called drunkenness. Drunkenness. Or the memory problem, person can't have a normal memory of the past. It's a difficulty in problem solving, and difficulty in concentrating. The person begins shaking the body. It's called tremors. And the loss of interest in the family. Person doesn't care about the family, his wife, his kids, and his friends. The person is all about drinking all the times. There is a medical assessment tool called DSM-5. It divides the alcohol use disorder into mild, moderate, and severe categories. It is a mental health assessment tool, DSM-5. There are different DSM tools, DSM-2, DSM-3, DSM-4, and DSM-5 is a assessing tool for the doctors and the nurses who categorize what stage of the alcohol abuse the person is in. So these are the things. Similarly, so how we can work with the people with the alcohol disorder, this is very important thing for us. For most people, exceeding 2 drinks a day can do significant harm. Like 2 drinks a day, little bit 2 drinks a day. When people exceed, they go beyond that 2 drinks a day, it can cause significant harm for them. Women who have more than 10 drinks a week, women who have more than 10 drinks a week, and men who have more than 15 drinks a week have higher rate of alcohol related problems. Older adults who live alone are at risk of alcohol abuse. Older adults who live in the community, their own home, because when they live in the facility, their chance of abusing alcohol is very less. They can't get the alcohol in the nursing home, in the long-term care homes. The main treatment is to avoid alcohol. The the main treatment for the alcoholic people is not to give them alcohol, just to avoid them. They may have a problem for some days, but they will manage it later. Support groups are there. Example, AA help people with drinking alcohol. Cessation, there are certain group, they can help people for how to stop taking alcohol, drinking alcohol. Similarly, we are discussing about certain personality disorders. Some people have a different personality disorder. Some are very common, some are not common. Personality disorder are a group of disorder involving rigid and socially unacceptable behavior. See, when people with the personality disorder, they have a rigid type of thought and socially unacceptable behavior they demonstrates. People with the personality disorder have a problem relating to others. They may be demanding, they may be hostile, they may be manipulative, to manipulate others, to motivate others for doing something bad of others. Personality disorders are not illness in a strict sense because they do not disrupt emotional, intellectual, or perceptual functioning. It is a disorder because of the person's habit or habitual way. They may be demanding, hostile, or manipulative. Personality disorders are not illness in the strict sense, but again, these are disorders. When they do not follow the real order, the systemic way of showing behavior, it becomes disorder, and this is the personality disorder. Main type of personality disorder include antisocial personality disorder. They become antisocial. They do not follow the established norms and value of the society. For example, psychopaths and sociopaths. Psychopaths they are thinking something bizarre and harming others, and sociopath is not following the established codes and conducts of the society. These are both are mentally uh, dysfunctional. They have a little regards for the moral or legal standard of society. See here, they don't have any moral standard. They do whatever they like to do. They have become immoral, and the legal standard of the society. In the society, certain codes of conducts are there. There is established norms and values in the society, but these people do not follow them at all. Avoidant personality disorder, socially inhibited, extremely sensitive to criticism, socially inhibited. See, this avoidant is extremely sensitive to criticism. These people are very, they don't want to hear something negative of them by other people, very sensitive to criticism. Borderline personality disorder, lack of identity. They don't have any identity, rapid mood changes. All the time they are just thinking something bizarre, something terrible, something bad for others, intense, unstable, interpersonal relationship. Their interpersonal relationship is not very happy, and impulsiveness. They are very impulsive people. They do not follow any logical pattern of thinking and logical way of behaving with other. They are emotional and they are unstable and they are impulsive. Dependent personality disorder, extreme need of other people. Always the person needs somebody's help there. Always needs somebody. Person is unable to make any decision on his or her own. If the person's judgment is dysfunctional, the person cannot make his or her own decision. The person needs always somebody to make the decision. This is called dependent personality disorder, always depending on others. Similarly, histrionic personality disorder. What is histrionic? It's a little bit tricky word. Histrionic, exaggerated, saying something bigger, often inappropriate, not acceptable way, inappropriate, displays the emotional reaction in everyday behavior. Displays the emotional reaction to everyday behavior, very inappropriate behavior. Narcissistic means very mean, very selfish. General lack of empathy. People don't have empathy. Need to be admired by other people. They want to be admired by other people. And this is called very meanness, another word for the narcissistic. And narcissism, there is another word for narcissistic, goes to narcissism. That's called the attitude of the people, narcissism. Obsessive compulsive personality disorder, we already discussed about that. Obsessive is certain idea coming to mind, and according to the idea, person starts doing, performing something. Perfectionism and inflexibility. The obsessive compulsive people are also called perfectionist. They need everything 100% and perfect. Paranoid personality disorder, distrust of other, paranoid. Nobody is trustworthy for the paranoid, including belief that others are exploiting. They are exploiting, misusing, harming, or trying to deceive them. These are the tendencies of those paranoid personality disorder. These are the habit of those paranoid personality disorder people. Schizoid personality disorder. From schizoid, what is this? This looks like schizophrenic. A very limited range of motion. Very limited range of motion. Person is static, it's unmovable, both in expressing, does not use very much words while expressing, telling something, and experiencing emotion, does not experience very nice positive emotions. Very limited. Speaks limited, range of motion limited, everything is limited. Personality disorder, continuing the common sign and symptom of the personality disorder, self-centeredness, me first attitude. It is called selfishness. It is, I already told you in the narcissistic, self-centered. I am the first, not others. Lack of individual accountability. Person do the work, but they are not being the accountable of their work, not taking the responsibility. Lack of empathy. People don't see the world from others' eyes. Always they are seeing the world of their own eyes, means they are very mean. Perspective taking. They are taking others' perspective for their own benefit. Perspective taking means Your idea, I'm taking your idea for my benefit. Manipulative, they manipulate other people for the benefit of their own. And exploitative behavior, they exploit, sexually exploit, financially exploit, they verbally exploit, whatever way they exploit. They try to take advantage of somebody. Unhappiness, always feeling depressed, unhappiness, depression, other mood and anxiety disorder. People have always the anxiety disorder. Vulnerability, people are vulnerable, of high risk of something to other mental disorder. Distorted means not in a whole picture. It's a distorted means fragmented of different pieces, distorted and superficial understanding of own and others' perceptions. Superficial means just the surface level understanding of own and others' perception. Perception means others' idea, others' thought process. Those personality disorder people, they try to influence the external world to confront the one's own need. See, again, the meanness is here, the selfishness is realized here. Try to influence the external world to conform to one's own need, just to confirm the own need, not others' need. They damn care others' need. Similarly, how we can work with the client having those personality disorder. There are so many ways to support the people who have different personality disorder, mental health disorder. Accept the client in a caring, non-judgmental way. See, in the mental health unit, we have to accept the client as the person is, and we have to be non-judgmental. We cannot make the image of the person in our own way. Speak to your client in a factual and professional manner and just make them aware of the fact. And professionally, we have to be very, very professional manner, very calm and quiet, but strong in your voice. You have to speak. Provide care and support as specified in the care plan. Always follow the care plan. This is your roadmap to follow. Refrain from giving any client your phone number. See, the sharing the personal information with those mentally disabled person, this will be the biggest mistake from the part of a healthcare worker. Never ever give your phone number to them. Email ID, email address, do not give them email or the information about your private life. So don't share any private information with these people. Do not accept gift. They try to give you something, they try to influence you by giving something, or they may give you some money and other item from your client. If they give you something, give to the nursing station or give to the supervisor or take the item to the office. If you have to accept the item at any cost, consult the client's significant other. Who is the significant other? Maybe the husband or the wife or the power of attorney. Significant others for ways to successfully deal with him or her. If you cannot successfully deal with him or her in the community setting, when you are working in somebody's house, you can ask with the significant others, if the husband or wife, or you can also ask the nursing supervisor or the nurse or the power of attorney. It is called POA, which is mentioned in the nursing care plan. You can contact them as well. Thank you for your patience to listening to chapter 35 section B lecture, and please read the lecture and read the book together and do the assignment. You can contact me through my email in the college website, and thank you. Have a great day. Bye.